NGN NCLEX NCLEX PN. Question 1. Teaching the client with gonorrhea how to prevent reinfection and further spread is an example of primary prevention, secondary prevention, tertiary prevention, primary health care prevention. Secondary prevention targets the reduction of disease prevalence and disease morbidity through early diagnosis and treatment. Question 2. Which of the following foods is a complete protein? Corn, eggs, peanuts, sunflower seeds. Eggs are a complete protein. The remaining options, corn, peanuts, sunflower seeds, are incomplete proteins. Question 3. Broccoli, oranges, dark greens, and dark yellow vegetables can be eaten to supplement vitamin pills, balance body molecules, cure many diseases, help improve body defenses. Certain foods can help improve body defenses to possibly prevent certain diseases. This falls under non-pharmacological therapies. Question 4. The major electrolytes in the extracellular fluid are potassium and chloride, potassium and phosphate, sodium and chloride, sodium and phosphate. Sodium and chloride are the primary electrolytes found in the extracellular fluid. Question 5. Which of the following nursing diagnoses might be appropriate as Parkinson's disease progresses and complications develop? Impaired physical mobility, dysreflexia, hypothermia, impaired dentition. Parkinson's disease often causes a shuffling gait and muscle rigidity, leading to impaired physical mobility. Question 6. Which of the following is an inappropriate item to include in planning care for a severely neutropenic client? Transfuse neutrophils, granulocytes, to prevent infection. Exclude raw vegetables from the diet. Avoid administering rectal suppositories. Prohibit vases of fresh flowers and plants in the client's room. Granulocyte transfusion is not indicated as a preventative measure for infection. It is reserved for specific infected, severely neutropenic populations. Question 7. A primary belief of psychiatric mental health nursing is: most people have the potential to change and grow. Every person is worthy of dignity and respect. Human needs are individual to each person. Some behaviors have no meaning and cannot be understood. Psychiatric nursing is based on the belief that every individual has inherent worth, dignity, and the potential for growth. Question 8. A teenage client is admitted for an acetaminophen, Tylenol, overdose. Which organ is at highest risk for life-threatening abnormalities? Lungs, liver, kidneys, adrenal glands. Acetaminophen is extensively metabolized in the liver, and overdose can lead to acute liver failure. Question 9. All of the following factors in a family history are correlated with poverty except high infant mortality rate, frequent use of emergency departments, consultation with folk healers, low incidence of dental problems. Those in poverty generally have a higher incidence of dental problems due to lack of access to preventative care. Question 10. Acyclovir is the drug of choice for HIV, HSV1 and 2 and VZV, CMV, influenza A viruses. Acyclovir, Zovirax, is an antiviral specific for herpes simplex virus, HSV, and varicella-zoster virus, VZV. Question 11. A client in the ED appears confused, complains of dizziness and nausea, has a rapid pulse, and is hyperventilating after an accident. What is the anxiety level? Mild, moderate, severe, panic. Severe anxiety is characterized by an inability to solve problems, poor environmental grasp, and physical symptoms like tachycardia and hyperventilation. Question 12. Which method of contraception is able to reduce the transmission of HIV and other STDs? Intrauterine device, IUD, Norplant, oral contraceptives, vaginal sponge. The vaginal sponge is a barrier method. When used with spermicidal foam/jelly, it reduces STD transmission risk, unlike hormonal or mechanical methods like IUDs. Question 13. Which fetal heart monitor pattern can indicate cord compression? Variable decelerations, early decelerations, bradycardia, tachycardia. Variable decelerations are typically caused by umbilical cord compression. Question 14. The nurse teaching about preventable diseases should emphasize getting which set of vaccines? Human papillomavirus, genital herpes, measles, pneumonia, HIV, mumps, syphilis, gonorrhea, pneumonia, polio, pertussis, measles. Polio, pertussis, and measles are standard preventable diseases controlled by routine childhood immunizations. Question 15. Which of the following conditions is mammography used to detect? Pain, tumor, edema, epilepsy. Mammography is a diagnostic imaging tool used specifically to detect tumors or cysts in breast tissue. Question 16. When determining the appropriate size of an oropharyngeal airway, the nurse should measure from the corner of the mouth to the tragus of the ear, corner of the eye to the top of the ear, tip of the chin to the sternum, tip of the nose to the earlobe. The correct size for an oropharyngeal airway is the distance from the corner of the mouth to the tragus of the ear. Question 17. Which sign might the nurse see in a client with a high ammonia level? Coma, edema, hypoxia, polyuria. High ammonia levels, hyperammonemia, often due to liver failure, can lead to hepatic encephalopathy and coma. Question 18. What do the following ABG values indicate? pH 7.38, P2 78 mmHg, PCO 236 mmHg, and HCO 324 milliequivalent/L. Metabolic alkalosis, homeostasis, respiratory acidosis, respiratory alkalosis. These values, pH 7.35 to 7.45, PCO 235 to 45, HCO 322 to 26, are all within normal ranges, indicating homeostasis. Question 19. Which of the following is the primary force in sex education in a child's life? School nurse, peers, parents, media. While schools, peers, and media are influential, parents remain the primary and most foundational force in sex education. Question 20. The nurse is examining an 18-month-old child. How many teeth should the nurse expect to find? 6, 8, 12, 16. A standard guide for toddlers is subtracting 6 from the child's age in months. 18 months 6 equals 12 teeth. Question 21. Which of the following medications is a serotonin antagonist used to relieve nausea and vomiting? Metoclopramide, Reglan, ondansetron, Zofran, hydroxyzine, Vistaril, prochlorperazine, Compazine. Ondansetron, Zofran, is a serotonin 5-HT3 receptor antagonist used for antiemesis. Question 22. A client has difficulty walking due to a mass in the digital nerve of the foot. How should the nurse document this? Plantar fasciitis, hallux valgus, hammer toe, Morton's neuroma. Morton's neuroma is a thickening of the tissue around one of the nerves leading to the toes, resulting in a small mass. Question 23. For a client with suspected appendicitis, the nurse expects tenderness in which quadrant? Upper right, upper left, lower right, lower left. Appendicitis typically causes pain and rebound tenderness in the lower right quadrant, McBurney's point. Question 24. Assessment of a client with a cast should include which of the following? Capillary refill, warm toes, no discomfort. Posterior tibial pulses, warm toes. Moist skin, pain threshold. Discomfort of the metacarpals. Neurovascular checks, circulation, motion, sensation, are vital. Slow refill, cool skin, or pain can indicate compromised circulation. Question 25. Which injury arriving in the emergency department is the highest priority? Open leg fracture, open head injury, stab wound to the chest, traumatic amputation of a thumb. A chest wound is the highest priority due to the immediate risk to breathing. In the ABCs, it can lead to pneumothorax or mediastinal shift. Question 26. Why must a nurse preserve the integrity of clothing, tears, stains, debris, for a trauma victim? The clothing is property of another. To facilitate repair of the clothing, it is potential evidence with legal implications. To decrease trauma to the family. In trauma cases, clothing and debris are considered forensic evidence and must be handled according to the chain of custody. Question 27. Which statement by parents of a newborn indicates they understand cord care? I should put alcohol on my baby's cord 3 to 4 times a day. I should put the baby's diaper on so that it covers the cord. I should call the physician if the cord becomes dark. I should wash my hands before and after I take care of the cord. Hand washing prevents pathogen transfer. The diaper should be folded below the cord, and alcohol is no longer routinely recommended. It is normal for the cord to turn dark. Question 28. A middle-aged woman reports irregular menses for the last 6 months. The nurse should assess for climacteric, menopause, perimenopause, postmenopause. Perimenopause is the transitional period of approximately 5 years where hormonal changes cause irregular menses leading up to menopause. Question 29. Which is an appropriate nursing diagnosis for an epileptic client? Dysreflexia, risk for injury, urinary retention, unbalanced nutrition. The primary nursing concern for an actively seizing client or one with a seizure disorder is safety and the prevention of injury. Question 30. Which condition is least likely to be associated with an increased potential for bleeding? Metastatic liver cancer, gram-negative septicemia, pernicious anemia, iron deficiency anemia. Pernicious anemia, B12 deficiency, affects RBC production but is not primarily associated with clotting/bleeding disorders like liver cancer or sepsis. Question 31. What is the highest flow rate for oxygen delivered via nasal cannula? 2 liters/minute, 4 liters/minute, 6 liters/minute, 8 liters/minute. Nasal cannulas are generally limited to 6 L/min. Higher rates require a mask to ensure proper oxygen concentration. Question 32. Demographic data shows that domestic batterers are from a minority culture in a low-income group, from a majority culture in a middle-income group, men who were never allowed to compete as children, from any walk of life, race, income group, or profession. Domestic abuse is not limited by socioeconomic status, race, or profession. Batterers can come from any demographic. Question 33. When fetal heart monitoring indicates fetal distress, which action should not be performed? Increase maternal fluids, administer oxygen, decrease maternal fluids, turn the mother. Decreasing fluids is inappropriate. Increasing fluids and oxygen while repositioning the mother are standard interventions for fetal distress. Question 34. A client experiencing severe anxiety manifests physical symptoms. What behavior is this? Acting out, somatizing, withdrawal, problem solving. Somatizing is the expression of psychological distress through physical, somatic, symptoms. Question 35. A client weighs 216 pounds and is 66 inches tall. What is the BMI classification? Within normal limits, lower than normal, indicating obesity because the BMI is 35, indicating overweight status because the BMI is 27. A BMI of 30 or higher is classified as obese. This client's calculated BMI is 35. Question 36. Which instruction is correct for a client undergoing mammography? Be sure to use underarm deodorant. Do not use underarm deodorant. Do not eat or drink after midnight. Have a friend drive you home. Deodorants/powders can contain metals that show up as false positives, shadows, on the X-ray. No fasting or sedation is required. Question 37. Avoiding foods high in potassium is most important for which client? A client receiving diuretic therapy, a client with an ileostomy, a client with metabolic alkalosis, a client with renal disease. Renal disease prevents the efficient excretion of potassium, putting the client at high risk for life-threatening hyperkalemia. Question 38. A diet high in fiber content can help an individual to lose body weight fast, reduce diabetic ketoacidosis, lower cholesterol, reduce the need for folate. Soluble fiber, found in oats, beans, apples, helps lower blood cholesterol levels. Question 39. When administering 4 electrolyte solutions, the nurse should infuse hypertonic solutions rapidly, mix no more than 80 milliequivalent of potassium per liter, prevent infiltration of calcium to avoid necrosis, increase digitalis dosage if giving 4 calcium. Calcium is a vesicant. Infiltration into local tissues causes severe sloughing and necrosis. Question 40. How often should the nurse change the 4 tubing on total parenteral nutrition (TPN) solutions? Every 24 hours, every 36 hours, every 48 hours, every 72 hours. TPN contains high concentrations of glucose, which encourages bacterial growth. Therefore, tubing must be changed every 24 hours. Question 41. Regarding alcohol consumption during pregnancy, the nurse should state, the amount of alcohol that is safe during pregnancy is unknown. 1 or 2 beers a day is considered safe. Only binge drinking is harmful during pregnancy. You can have a drink to help you relax at night. There is no known safe amount of alcohol during pregnancy. Abstinence is the only way to prevent fetal alcohol syndrome. Question 42. A 10-month-old is difficult to awaken and has bruises on both upper arms. This is most consistent with wearing clothing that is too small, the child being shaken, falling while learning to walk, parents trying to awaken the child. Bruising on the upper arms and a decreased level of consciousness are hallmark indicators of shaken baby syndrome. Question 43. For which of the following conditions might blood be drawn for uric acid level? Asthma, gout, diverticulitis, meningitis. Uric acid levels are diagnostic for gout, as the condition is caused by the accumulation of urate crystals in the joints. Question 44. In a DIC client on a heparin drip, which finding indicates a positive response to therapy? Increased platelet count, increased fibrinogen, decreased fibrin split products, decreased bleeding. Heparin stops the consumption of clotting factors, therefore, an increase in available fibrinogen indicates the clotting cascade is being controlled. Question 45. Which is an appropriate nursing goal for a client at risk for nutritional problems? Provide oxygen, promote healthy nutritional practices, treat complications of malnutrition, increase weight. Goal statements should be patient-centered and outcome-oriented, such as promoting healthy nutritional habits. Question 46. Which is a major competency for a nurse providing end-of-life care? Demonstrating respect and compassion for the family and client, assessing only the family's needs, setting static changes to care, keeping all sad news away from the client. End-of-life care requires high levels of empathy, respect, and clinical skill in managing both the patient and the family's needs. Question 47. The PACU nurse notes serosanguinous drainage on a fresh cholecystectomy dressing. The nurse should notify the physician immediately, change the dressing, reinforce the dressing, apply an abdominal binder. Initial surgical dressings are typically reinforced rather than changed by the nurse to reduce infection risk and maintain a sterile environment. Question 48. A client has excessive stretching of a ligament. This should be documented as a sprain, strain, subluxation, distoration. A strain is an injury to a muscle or a ligament, stretching, whereas a sprain typically involves twisting and tearing of muscles/ligaments. Question 49. Visible blood at the urethral meatus following trauma requires which intervention? Insertion of a Foley catheter, in and out catheter for urinalysis, avoided urine specimen, a urologist consult. Blood at the meatus is a sign of urethral trauma. Catheterization is contraindicated until injury is ruled out by a specialist. Question 50. Which action helps meet the outcome of positive body image in a child with Kawasaki disease? Administering immune globulin intravenously, assessing extremities for redness every 8 hours, explaining progression of the disease to the family, assessing heart sounds, educating the family that physical symptoms, like skin peeling and tongue redness, are temporary helps maintain a positive body image. Question 51. A Hodgkin's disease client is receiving MOPP chemotherapy. Which side effect most affects body image? Cushingoid appearance, alopecia, sterility, pathologic fractures. Alopecia, hair loss, is a significant side effect of chemotherapy that directly impacts a client's body image. Question 52. A Native American woman requests a medicine woman be present during monitoring. The nurse should. I will assist you in arranging to have a medicine woman present. We do not allow medicine women in exam rooms. That does not make any difference in the outcome. It is old-fashioned to believe in that. The nurse should accommodate cultural requests to provide culturally competent and supportive care. Question 53. The goals of palliative care include all except quality of life for life-threatening illness, taking care of the whole person, no interventions needed because death is near, support of the needs of the family. Palliative care involves active management of symptoms and needs until the end of life. It is not the absence of intervention. Question 54. When helping a client gain insight into anxiety, the nurse should help relate anxiety to specific behaviors, ask the client to describe events that precede increased anxiety, instruct the client to practice relaxation techniques, confront the client's resistive behavior. To develop insight, a client must recognize the stressors or triggers that cause the anxiety to escalate. Question 55. Which statement by a mother of a child with a seizure disorder indicates a need for further teaching? I should make sure he gets plenty of rest. I should get him a medic alert bracelet. I should lay him on his back during a seizure. I should loosen his clothing during a seizure. Clients should be placed on their side, not their back, during a seizure to prevent aspiration. Question 56. To remove hard contact lenses from an unresponsive client, the nurse should irrigate from the inner canthus outward, grasp the lens with a pinching motion, don sterile gloves, ensure the lens is on the cornea before manipulating lids. The lens must be centered on the cornea before lids are manipulated to avoid scratching the sclera or cornea. Question 57. Which food should be restricted for a client with hypercholesterolemia? Broiled catfish, hamburgers, wheat bread, fresh apples. Red meats like hamburgers are high in saturated fat and cholesterol and should be limited. Question 58. Nurses caring for cancer clients on opioids need to assess for all except tolerance, constipation, sedation, addiction. While tolerance, sedation, and constipation are clinical concerns, addiction is rarely a priority in the management of terminal cancer pain. Question 59. Which nursing action is most effective when evaluating a kinetic family drawing? Telling the child to draw the family doing something, offering suggestions of what to draw, discouraging the child from talking, noting the omission of any family members. Omissions or specific placements of family members provide diagnostic insight into the child's perception of family dynamics. Question 60. Which electrolyte is lost during intestinal tube suctioning? Calcium, magnesium, potassium, sodium chloride. Intestinal fluids are rich in sodium and chloride. Suctioning these fluids can lead to hyponatremia and hypochloremia. Question 61. Which of the following terms refers to soft tissue injury caused by blunt force? Contusion, strain, sprain, dislocation. A contusion, bruise, is caused by blunt trauma that does not break the skin but causes capillary rupture and swelling. Question 62. Which of the following indicates a hazard for a client on oxygen therapy? A no smoking sign is on the door. The client is wearing a synthetic gown. Electrical equipment is grounded. Matches are removed. Synthetic fabrics can create static sparks, which are highly dangerous in an oxygen-enriched environment. Question 63. Erythropoietin, EPO, for renal failure anemia should be given with iron, folic acid, and B12, an increase of protein in the diet, vitamins A and C, an increase of calcium in the diet. EPO stimulates RBC production, but the body must have adequate building blocks, iron, folate, B12, for the cells to form correctly. Question 64. Which is a contraindication for hormone replacement therapy, HRT, in a menopausal woman? Family history of stroke, ovaries removed before age 45, frequent hot flashes, unexplained vaginal bleeding. Unexplained vaginal bleeding must be investigated to rule out malignancy before starting HRT. Question 65. A pregnant Asian client asks to take ginger for morning sickness. The nurse should. I will call your physician to see if we can start some ginger. We don't use home remedies in this clinic. Herbs are not as effective as regular medicines. Just eat some dry crackers instead. Ginger is an evidence-based remedy for nausea. The nurse should consult the provider to ensure it is integrated safely into the care plan. Question 66. Which finding in an 11-12-month-old child indicates a risk for developmental dysplasia of the hip? Refusal to walk, not pulling to a standing position, negative Trendelenburg sign, negative Ortolani sign. Failure to pull to a stand by 12 months is a developmental delay that warrants investigation for hip pathology. Question 67. A client with which condition is at risk for developing high ammonia levels? Renal failure, psoriasis, lupus, cirrhosis. The liver converts ammonia to urea. In cirrhosis, the liver cannot process ammonia, leading to toxic accumulation in the blood. Question 68. What is the primary nutritional deficiency of concern for a strict vegetarian? Vitamin C, vitamin B12, vitamin E, magnesium. Vitamin B12 is found almost exclusively in animal products. Vegetarians must supplement to avoid deficiency. Question 69. Which food should be avoided by a client with gastroesophageal reflux disease, GERD? Lettuce, eggs, chocolate, butterscotch. Chocolate lowers the pressure of the lower esophageal sphincter, allowing gastric contents to reflux. Question 70. A client is being tapered off Xanax. Which statement shows understanding? I can drink alcohol while decreasing Xanax. I should just stop taking them today. I should take 3 per day next week, then 2, then 1. I will be sleepy for days after stopping. Benzodiazepines must be tapered slowly to prevent severe withdrawal symptoms like seizures. Question 71. A client requires an increased dose of Vicodin for pain and asks if he is addicted. The nurse knows that the body has developed tolerance, requiring more drug for the same effect. The client is experiencing loss of control and dependence. Addiction describes physical dependence and withdrawal. The client has a dual diagnosis of abuse and pain. Tolerance is a physiological state where the body requires more of a substance to achieve the previous clinical effect. Question 72. When transferring a client with hemiparesis to a wheelchair, the nurse should walk the client to the chair, pivot the client on the unaffected extremity, pivot the client on the affected extremity, have the client push their own body. Pivoting on the strong unaffected leg provides maximum stability and support during the transfer. Question 73. Which positioning is correct for dumping syndrome versus GERD? Sit up 1 hour after meals, lie flat 30 minutes after meals. Lie down 1 hour after eating, sit up at least 30 minutes after eating. Sit up after meals, sit up after meals. Lie down after meals, lie down after meals. Lying down after meals slows gastric emptying, dumping syndrome. Sitting up prevents reflux, GERD. Question 74. Which organ of the digestive system has the primary function of absorption? Stomach, pancreas, small intestine, gallbladder. The small intestine is the site where the majority of nutrient absorption occurs. Question 75. Which neurological disorder is characterized by involuntary writhing movements of the face and limbs? Epilepsy, Parkinson's, muscular sclerosis, Huntington's chorea. Choreiform, writhing, movements are a hallmark of Huntington's disease. Question 76. When teaching parents about feeding a newborn, the nurse should include: use the defrost setting on microwaves to warm bottles. Discard partially used refrigerated bottles after 24 hours. Mix formula concentrate in a 2-to-1 ratio. Add new formula to leftovers from the last bottle. Microwaves can create hot spots in milk. If used, the defrost setting and careful temperature checking are required. Question 77. An immobilized traction client is constipated. Which medication is likely to be ordered? Advil, Anacid, Clinicil, Colis. Colis, docusate sodium, is a stool softener commonly used to prevent straining in immobile patients. Question 78. Which type of meal is most likely to cause rapid gastric emptying, dumping syndrome? High-protein meal, high-fat meal, a large meal regardless of content, high-carbohydrate meal. Simple carbohydrates exit the stomach quickly, which can trigger dumping syndrome in post-gastrectomy patients. Question 79. Many domestic batterers report a childhood history of growing up in a secure home, being an only child, being physically or psychologically abused, admitting problems with anger. There is a strong correlation between being a victim of childhood abuse and becoming a batterer in adulthood. Question 80. An obese client says she needs surgery because nothing else has worked. The nurse should respond: if you eat less, you can save some money. Exercise is a healthier way to lose weight. You should try the Atkins diet first. I respect your decision to choose surgery. The nurse should provide non-judgmental support and respect the client's autonomy in their health decisions. Question 81. Major areas of importance for a client in Bucks traction include nutrition, ROM exercises, transportation, nutrition, elimination, comfort, safety, elimination, safety, isotonic exercises. Care for traction patients focuses on preventing complications of immobility, ensuring comfort, and maintaining safety. Question 82. Light therapy is an effective treatment for overcoming weight problems, helping with allergies, alternative medical treatments, working with sleep patterns. Light therapy is used to regulate circadian rhythms and treat seasonal affective disorder, SAD. Question 83. Assessment of a client with an AV fistula for hemodialysis should include inspection for visible pulsation, palpation of thrill, percussion for dullness, auscultation of blood pressure. A palpable thrill and audible bruit are essential signs that an AV fistula is patent and functioning. Question 84. A child gets a low grade and kicks the dog. This coping mechanism is denial, suppression, displacement, fantasy. Displacement involves redirecting an emotional impulse, like anger, from a threatening target to a safer, substitute one. Question 85. Which condition is associated with inadequate intake of vitamin C? Rickets, marasmus, kwashiorkor, scurvy. Scurvy is the clinical manifestation of severe vitamin C deficiency. Question 86. Which is the proper hand position for performing chest percussion? Cup the hands, use the side of the hands, flatten the hands, spread the fingers. Cupping the hands creates an air pocket that generates the vibration needed to loosen lung secretions. Question 87. Factors associated with an increased risk of STDs include alcohol use, certain types of sexual practices, minority status/poverty, all of the above. High-risk sexual practices, substance use that lowers inhibitions, and lack of access to healthcare are all risk factors. Question 88. Why might breast implants interfere with mammography? They cause additional discomfort. They are contraindications. They are likely to be dislodged. They might prevent detection of masses. Implants can compress or hide breast tissue, making it harder for the radiologist to see small tumors or abnormalities. Question 89. To prevent child abuse in an overwhelmed new mother, the healthcare worker should immediately contact Child Protective Services, provide literature about child care, consult a therapist, refer the mother to parenting classes. Parenting classes provide education and social support, which are the most effective preventative tools against child abuse. Question 90. Which is the proper hand position for performing chest vibration? Cup the hands, use the side of the hands, flatten the hands, spread the fingers. Flattening the hands over the chest allows the practitioner to transmit a fine shaking motion to loosen secretions. Question 91. Which lab value is associated with a decreased risk of cardiovascular disease? High HDL cholesterol, low HDL cholesterol, low total cholesterol, low triglycerides. HDL is good cholesterol, high levels are cardioprotective. Question 92. When making an occupied bed, the nurse should keep the bed in the low position, use a bath blanket for warmth and privacy, keep both side rails raised, move back and forth to adjust linens. A bath blanket ensures the patient is never fully exposed during the linen change, maintaining dignity and warmth. Question 93. What is an appropriate immediate intervention for a conscious hypoglycemic client? 1 glucose tablet, 2 hard candies, 4 to 6 ounces of juice with added sugar, 2 to 3 teaspoons of honey. Honey is a concentrated fast-acting simple carbohydrate that will quickly raise blood glucose levels. Question 94. A seizing client's oxygen saturation drops from 92% to 82%. What is the first action? Open the airway, administer oxygen, suction the client, check for breathing. Opening the airway is the priority to ensure the client can receive oxygen and maintain ventilation. Question 95. To remove a client's gown who has an 4-line, the nurse should disconnect the tubing close to the client, cut the gown with scissors, thread the bag and tubing through the gown sleeve, disconnect the tubing from the 4 container. Threading the bag through the sleeve allows the gown to be removed without breaking the sterile 4 system. Question 96. Which diagnosis is most likely for the family of an infant newly diagnosed with hemophilia, immobility, altered growth and development, hemarthrosis, altered family processes? A new diagnosis of a chronic illness significantly disrupts family dynamics and stressors, leading to altered family processes. Question 97. Which value should be monitored most closely for a client on TPN? Calcium, magnesium, glucose, cholesterol. TPN has extremely high sugar content. Monitoring for hyperglycemia is the highest priority. Question 98. Which advice is appropriate for a client with stress incontinence? Purchase absorbent undergarments. Kegel exercises might help. Surgical treatments are non-existent. Behavioral therapy is ineffective. Kegel exercises strengthen the pelvic floor muscles, which can significantly reduce or eliminate stress incontinence. Question 99. Diagnostic genetic counseling allows clients to do all except terminate the pregnancy, prepare for the birth of a child with special needs, access support services, complete the grieving process before birth. Grieving is an ongoing process that often continues long after a diagnosis or birth. It is rarely completed before the event. Question 100. A client says, "I feel I will be incomplete if I cannot have a child." What is the appropriate diagnosis? Risk for self-harm, body image disturbance, ineffective role performance, powerlessness. The client's statement links their physical function/reproduction to their sense of self, indicating a body image disturbance. Question 101. An assessment of a normal 10-month-old baby's skull should identify closure of the posterior fontanelle, closure of the anterior fontanelle, overlap of cranial bones, ossification of the sutures. The posterior fontanelle usually closes by 2 months. The anterior fontanelle remains open until 12 to 18 months. Question 102. Attaching a restraint to a side rail can do nothing. Injure the client if the rail is moved. Keep them in bed. Help with posture. Restraints should only be attached to the non-movable part of the bed frame to prevent injury. Question 103. DNA alkylating agents, chemotherapy, are effective because they cross-link DNA strands with covalent bonds, have no side effects, are used for only one cancer type, are cell cycle specific. Alkylating agents interfere with DNA replication by creating crosslinks between DNA strands. Question 104. Using clichés in therapeutic communication leads the client to view the nurse as human, accept themselves as human, self-disclose, feel discounted. Clichés, example, everything happens for a reason, minimize the client's unique experience and make them feel unheard. Question 105. Which measure best promotes sleep in a hospitalized client? Vigorous exercise at 9:30 p.m., cool shower and hot tea, watching TV until midnight, back rub and warm milk. Back rubs promote relaxation, and warm milk contains tryptophan, both of which aid sleep. Question 106. Ethical and moral issues concerning restraints include all except emotional impact, dignity, quality of life, policies and procedures. While policies are administrative/legal requirements, dignity and quality of life are the core ethical concerns. Question 107. A false report where a test is labeled positive but the disease is not present is A. Positive, false positive, negative, false negative. A false positive occurs when the test incorrectly identifies a condition that does not exist. Question 108. A client reports talking to the voices. The nurse's first action should be touching the client, leaving them alone, asking the client to describe what is happening, telling them there are no voices. The nurse should acknowledge the client's reality and ask about the content of the hallucinations to assess for safety. Question 109. Which is false regarding organ donation? The physician in charge makes the final decision. The legally responsible party may make the decision. The organ procurement organization decides which organs to harvest. All of the above. The physician cannot unilaterally decide. The consent of the legal guardian/next of kin is required. Question 110. High uric acid levels during chemotherapy are caused by kidney inability to excrete metabolites, rapid cell catabolism, toxic effects of antibiotics, altered blood pH. Chemotherapy kills large numbers of cells, catabolism, releasing intracellular contents like uric acid into the blood. Question 111. A realistic short-term goal for a rape victim in a brief treatment program is identify all psychosocial problems, eliminate enticing behaviors, resolve feelings of trauma and fear, verbalize feelings about the event. Initial crisis management focuses on the expression of feelings and acute stabilization, not long-term resolution. Question 112. The vast majority of deaths from unintentional poisoning occur in infants, toddlers, teens, adults. Toddlers are at highest risk due to their developmental curiosity and tendency to put objects in their mouths. Question 113. Common supervisor problems include all except the supervisor facilitates development of staff, the supervisor micromanages, the supervisor controls the style of performance, the supervisor does not delegate. Facilitating staff development is a sign of effective leadership, not a management problem. Question 114. Which respiration pattern is a sign of impending death? Elevated blood pressure, Cheyne-Stokes respiration, elevated pulse rate, decreased temperature. Cheyne-Stokes, cycles of deep breathing and apnea, is often seen in the active phase of dying. Question 115. A state of respiratory acidosis often causes which electrolyte imbalance? Normal potassium, elevated potassium, low potassium, unrelated to pH. In acidosis, hydrogen ions enter the cells and push potassium out into the extracellular fluid, hyperkalemia. Question 116. The most common cause of first-degree burns in small children is scalding, contact with hot surfaces, flash burns, sunburn. While scalding is a major source of severe burns, sunburn is the most common first-degree burn. Question 117. Which response helps a widow's self-esteem regarding managing finances? You feel inadequate because you never learned. You should have insisted your husband teach you. You are strong and will learn how to manage. Why don't you take a class at the college? Communicating confidence in the client's ability to learn and solve problems helps bolster their self-esteem. Question 118. When should a nurse's daily care plan be altered? Halfway through the shift, at the end of the shift, when needs change, after top tasks are done. Nursing care is dynamic. The plan must be modified immediately whenever the patient's needs or condition changes. Question 119. Which is not a sign of impaired breathing in an infant? Nasal flaring, grunting, seesaw breathing, quivering lips. nasal flaring, grunting, and seesaw, retractive, breathing are all classic signs of respiratory distress in infants. Question 120. A manager who initiates conversation and encourages participation is demonstrating aggressiveness, passive-aggressiveness, passiveness, assertiveness. Assertiveness involves clear, direct, and respectful communication and engagement. Question 121. To help a client determine a suitable diet for disease prevention, the nurse should first provide copies of ADA/AHA guidelines, ask the client for a list of foods she usually eats, provide a high-protein plan, provide info on risk factors. Assessment of current habits must occur before a tailored plan can be developed. Question 122. An opiate-overdosed patient with respiratory depression would likely be given naloxone, Narcan, labetalol, Normodine, neostigmine, prostigmine, thiethoxine, Navini. Naloxone is the specific antagonist used to reverse the effects of opioid-induced respiratory depression. Question 123. Which statement about erythema infectiosum, Fifth's disease, is not correct? There is no rash. The disorder is uncommon in adults. There is no fever. There is a slapped face appearance. Erythema infectiosum is characterized by a distinctive red rash on the face and body. Question 124. What vaccines should a 12-month-old child have received? Measles, polio, pertussis, hepatitis B, diphtheria, pertussis, polio, tetanus, rubella, polio, pertussis, hepatitis A, measles, mumps, rubella, polio. DTaP and polio are standard by 12 months. The first MMR is usually given at or after 12 months. Question 125. Methods of preventing cancer include sleeping 6 to 8 hours, monthly self-breast exams, reducing stress, all of the above. Maintaining homeostasis, early detection, and managing the physiological effects of stress all contribute to cancer prevention. Question 126. Which specialist treats postmenopausal bleeding? Radiologist, gynecologist, physiatrist, oncologist. A gynecologist specializes in the female reproductive system and should evaluate any abnormal bleeding. Question 127. Which is most important when assessing a client's breathing? Presence of breathing and pulse rate, breathing pattern and adequacy, presence and adequacy of breathing, patient position and adequacy. The nurse must verify both that the patient is breathing and that the ventilation is sufficient, adequate, to meet oxygen needs. Question 128. Sudden weakness and breathing difficulty among multiple airline passengers likely indicates Asian flu, chemical exposure, bacterial pneumonia, allergic reaction. A cluster of identical acute symptoms in a group of people at the same time points to an environmental/chemical cause. Question 129. What is the best way to ask an elderly client about suspected abuse? How did you get those bruises? Did someone grab you by your arms? Do you fall often? What did you bump against? Direct, non-judgmental questioning is the most effective way to elicit information about physical abuse. Question 130. What is the second step of a psychosocial assessment after problematic behaviors are described? Feelings about the behavior, thoughts about the behavior, possible solutions, intent in sharing. Assessment should flow from simple description to cognitive interpretation, thoughts, before moving to deeper emotional disclosure, feelings. Question 131. The nurse's response to a mother downplaying her son's sexual abuse should be based on male victims seldom have long-term problems. Survivors might become confused about their sexual identity. Untreated survivors always become abusers. Needs are identical regardless of gender. Male survivors of sexual abuse have specific psychological needs and risks, including potential confusion regarding sexual identity. Question 132. Identification of transference occurs in which phase of the nurse-client relationship? Establishment of roles, orientation phase, family structure placement, authority agreement. Transference, the client projecting feelings onto the nurse, often begins and is identified during the initial orientation phase. Question 133. Which ethnic group is at highest risk for pesticide-related injuries in the U.S.? Native American, Asian Pacific, Norwegian, Hispanic. Because of the high representation of Hispanic individuals in agricultural migrant work, they face higher exposure to pesticides. Question 134. To increase a client's expression of feelings, the nurse should tell the client to stop using denial, positively reinforce each expression of feelings, instruct the client to express feelings, challenge the client each time denial is used. Positive reinforcement of the desired behavior, expressing feelings, is more effective than confronting defense mechanisms. Question 135. Teaching biofeedback to a stressed executive is an example of which intervention? Structure, relaxation technique, time management, regular exercise. Biofeedback is a relaxation technique that helps individuals gain voluntary control over physiological stress responses. Question 136. The primary focus of a nurse case manager is nursing care needs at discharge, comprehensive care needs for continuity of care, education needs upon discharge, financial resources for needed care. Case management aims to coordinate all aspects of care across the entire healthcare continuum to ensure continuity. Question 137. Rape crisis counseling by a nurse specialist in the ED is an example of assessment, crisis intervention, empathetic concern, unwarranted intrusion. Crisis intervention provides immediate, short-term psychological support to help a victim cope with a traumatic event. Question 138. Which is a barrier to an elderly person admitting they are being abused? Knowledge that elder abuse is rare, belief that abuse is deserved, lack of screening tools, fear of reprisal or further violence. Victims often fear that reporting abuse will lead to worse violence or forced placement in a nursing home. Question 139. The death of a spouse is which type of crisis? Maturational, reactive, non-reactive, situational. A situational crisis is an external, often sudden event that disrupts an individual's equilibrium. Question 140. When should termination of the nurse-client relationship first be addressed? Working phase, termination phase, orientation phase, when the client brings it up. The boundaries and expected duration of the therapeutic relationship should be clear from the very beginning. Question 141. The drug of choice to decrease uric acid levels in gout is prednisone, colisone, allopurinol, ziloprem, indomethacin, indocin, hydrochlorothiazide, hydrodiaryl. Allopurinol is a xanthine oxidase inhibitor used specifically to lower serum uric acid. Question 142. Support system enhancement includes all except determining barriers to using systems, discussing ways to help with concerned others, exploring life problems of support team members, involving family in care planning. The focus should be on the patient's support. The personal problems of the supporters themselves are not the priority. Question 143. The intent of the Patient Self-Determination Act, PSDA, is to enhance personal control over legal care, encourage medical decision-making prior to need, give one federal standard for living wills, emphasize client education. The PSDA requires facilities to inform patients of their right to make healthcare decisions and provide advanced directives before they become incapacitated. Question 144. To promote sleep in a hospitalized 4-year-old, the nurse should turn out the light and close the door, tire the child with evening exercises, identify and follow home bedtime rituals, encourage friend visitation. Preschoolers rely heavily on routines to feel safe enough to fall asleep in a strange environment. Question 145. In a disaster, the nurse assessing a diabetic client focuses on all except diabetic signs and symptoms, nutritional status, bleeding problems, availability of insulin. Bleeding is not a typical acute complication of diabetes, whereas glucose levels and insulin access are critical. Question 146. Which is true regarding fat emulsions in TPN? They have a high energy to fluid volume ratio. They are poorly tolerated. They are basic solutions. The pH is alkaline. Fat emulsions provide a high number of calories in a small volume, making them an efficient energy source. Question 147. The theory explaining a family's concept of health and illness is the health belief model, education school completing factor, family health expert factor, disconnected family factor. The health belief model explains how individual/family perceptions and motivations influence health-seeking behaviors. Question 148. The most common cause of injury/death from a house fire is explosion, falls, thermal damage, inhalation injury. Smoke inhalation and carbon monoxide poisoning cause more fire-related deaths than actual flames. Question 149. Legal protection of confidentiality extends to written documentation only, electronic info only, court systems only, both written and verbal information. HIPAA and other privacy laws protect all forms of identifiable health information, whether spoken or written. Question 150. An example of a skilled support service for a diabetic patient is shopping for groceries, house cleaning, transportation, medication instruction. Medication instruction requires the clinical knowledge of a licensed professional, nurse/pharmacist, making it a skilled service. Question 151. The 24-hour day-night cycle is the circadian rhythm, infradian rhythm, ultradian rhythm, non-REM rhythm. Circadian rhythms are the internal biological processes that follow a 24-hour cycle. Question 152. Rehabilitation services should begin when the client enters the system, after the client requests them, after physical stabilization, at discharge. Rehabilitation is most effective when started as early as possible in the patient's recovery process. Question 153. Which individual may legally give informed consent? 86-year-old with advanced Alzheimer's, 14-year-old requiring appendectomy, non-emancipated, 72-year-old scheduled for heart transplant, 6-month-old infant. The 72-year-old is a competent adult. The others are either minors or mentally incompetent and require a surrogate. Question 154. Which isolation procedure is followed for all secretions in blood? Respiratory, standard precautions, contact isolation, droplet. Standard precautions are the baseline for all patient care to prevent the transmission of bloodborne and other pathogens. Question 155. What happens to a drug that is bound to protein? It is more available. It distributes faster to receptors. It is less available for medicinal effects. It is metabolized faster by the liver. Only free or unbound drugs can interact with receptors. Protein-bound drugs remain in the vascular space. Question 156. Common reasons nurses avoid delegation include all except lack of self-confidence, desire to maintain authority, confidence in subordinates, the "I can do it better" mindset. Nurses who trust their team's skills are more likely to delegate tasks appropriately. Question 157. A client complaining about the cost of hospitalization is likely to demand all except the right to question the bill, the right to reasonable response to requests, the right to refuse treatment, the right to confidentiality. While confidentiality is a right, it is not typically what a patient demands in direct response to financial concerns. Question 158. A wrong committed against a person or property that results in a civil trial is a tort, crime, misdemeanor, felony. Torts are civil wrongs, like negligence or malpractice, whereas crimes are handled in the criminal justice system. Question 159. The greatest time savers when planning care include all except reacting to the crisis of the moment, setting goals, planning, specifying priorities. Reacting to crises is a time waster. Proactive planning and goal setting are time savers. Question 160. ABGs show pH 7.35, PCO 240, Pa 263, Sa 293%. What is the etiology? Tuberculosis, pneumonia, pleural effusion, hypoxia. A low partial pressure of oxygen, Pa2, and low saturation, Sa2, are the definitions of hypoxia. Question 161. Advocacy for client self-determination is the primary focus of malpractice insurance, nursing's advocacy for clients, confidentiality, healthcare. Nursing advocacy centers on protecting the patient's autonomy and their right to make their own healthcare decisions. Question 162. A chemotherapy patient's platelets fall to 98,000. Which action is least likely to increase hemorrhage risk? Test excreta for occult blood. Use a soft toothbrush. Implement reverse isolation. Avoid IM injections. Reverse isolation protects the patient from external germs but does not impact their internal clotting ability. Question 163. In providing culturally competent care for a family from the Philippines, the nurse must first review their own cultural beliefs and biases, request the couple use only approved providers, insist they learn the new country's practices, study family dynamics. Self-awareness of one's own biases is the foundational step in providing culturally sensitive care. Question 164. A client on rifampin for meningitis should be advised that urine will turn blue. They are infectious for 48 hours. Contact lenses might be stained orange. Skin will crimson glow. Rifampin causes harmless but noticeable orange discoloration of urine, sweat, tears, and can stain contact lenses. Question 165. Which statement about genital herpes is true? Do not sit on toilet seats. Oral sex does not transmit the virus. Transmission can occur even when asymptomatic. Drink fluids to flush the tract after sex. Asymptomatic viral shedding allows genital herpes to be transmitted even when no sores are present. Question 166. A person with a recent tattoo should be screened for tuberculosis, herpes, hepatitis, syphilis. Tattooing involves needles. If equipment is not sterile, it poses a major risk for hepatitis B and C. Question 167. How often must physical restraints be released? Every 2 hours. Between 1 and 3 hours. Every 30 minutes. At least every 4 hours. Legal and safety standards require restraints to be released and the patient's skin/circulation assessed every 2 hours. Question 168. A client who recently lost a child says, "I don't want to make new friends." This is an indicator of emotional behavioral stress, spiritual stress, sociocultural stress, intellectual stress. Changes in how one interacts with their social environment/community are sociocultural indicators of stress. Question 169. Which client can safely receive the MMR vaccine? A pregnant woman, an immunocompromised person, a person with a neomycin allergy, a person with a head cold but no fever. MMR is a live vaccine. Pregnancy and immunosuppression are contraindications. A minor cold without fever is not. Question 170. Quality care is defined as all except conforming to standards, performing at the minimally acceptable level, meeting customer requirements, exceeding customer expectations. Minimally acceptable care is the floor of safety, not the standard of quality care. Question 171. A 2-year-old child with HIV should receive which supplemental vaccine? Pneumococcal vaccine, hepatitis A vaccine, Lyme disease vaccine, typhoid vaccine. Children with HIV are at high risk for invasive bacterial infections and should receive the pneumococcal vaccine. Question 172. Which of the following is not an example of a social support system? Call-in helplines, emotional assistance from others, community support groups, use of personal coping skills. Coping skills are internal individual strategies. Support systems are external resources. Question 173. Which statement describes a medication with a narrow therapeutic index, limited pharmacokinetic variability, requires no monitoring, less than twofold difference in toxic versus effective levels, limited potency and side effects? Narrow therapeutic index means the margin between a safe dose and a toxic dose is very small. Question 174. How does a nurse assess for a complete airway obstruction in an emergency? Ability to speak, ability to hear, oxygen saturation, adventitious breath sounds. A person with a total airway obstruction cannot speak, cough, or breathe. Question 175. Ampicillin and gentamicin are incompatible. How should the nurse administer them? Simultaneously, sequentially with a thorough flush between. Wait for the pharmacy to decide. Wait 4 hours between drugs. The differing pH levels of these drugs can cause precipitation. They must be given separately with flushing. Question 176. Testing that correctly identifies clients who do not have a diseases. Specific, sensitive, negative culture, marginal finding. Specificity is the ability of a test to correctly identify those without the disease, true negatives. Question 177. What is the correct position for palpating the thyroid? Neck flexed toward the side being examined. Neck hyperextended backward. Neck flexed away from the side examined. Neck flexed directly forward. Flexing the neck toward the side being examined relaxes the sternocleidomastoid muscle, allowing for easier palpation. Question 178. A chemical reaction between drugs prior to administration is a drug incompatibility, a side effect, an adverse event, an allergic response. Drug incompatibility occurs when 2 or more substances react chemically outside the body, often forming a precipitate. Question 179. Which is an example of age-appropriate play for a 2-year-old? Building towers with blocks, coloring within lines, saying mine during play, jumping rope. Toddlers are in a developmental stage of possessiveness and egocentrism, commonly using the word mine. Question 180. What should a nurse do first after an emergency delivery of a baby? Place padding under the mother. Cut the umbilical cord. Suction the baby's mouth and nose. Wrap the baby in a blanket. Clearing the airway, suctioning, is the absolute priority to initiate breathing in a newborn. Question 181. Vaccines provide which type of immunity? Active, passive, transplacental, active and passive. Vaccines stimulate the body's own immune system to produce antibodies, creating active immunity. Question 182. What is the advantage of using a central venous access device, CVAD, for chemotherapy? Less expensive. Weekly administration. Drugs can be caustic to smaller veins. Family can give drugs at home. Many chemo drugs are vesicants. Infusing them into a large central vein prevents the tissue damage, extravasation, that would occur in smaller peripheral veins. Question 183. Incident reports are used in risk management to provide liability protection, provide data to determine how to avoid future problems, discipline staff for errors, all of the above. Incident reports are internal quality improvement documents used to identify system failures and improve safety. Question 184. A client says there must be a mistake regarding a terminal diagnosis. This is denial, anger, bargaining, acceptance. Denial is the first stage of grief, serving as a protective buffer to the shock of bad news. Question 185. Honey-colored drainage and maculopapular lesions around a child's mouth indicate chickenpox, a non-contagious infection, impetigo, shingles. Classic impetigo presents with a characteristic honey-crusted lesion and is highly contagious. Question 186. A patient talking to the voices is best managed by the nurse. Touching the client to return to reality. Leaving the client alone. Asking the client to describe what is happening. Telling the client there are no voices. Assisting the client to return to reality is the goal. However, assessment, option C, usually precedes physical touch in many clinical guidelines. Note, source answer A differs from standard 108. Question 187. A syringe pump is most commonly used for which population? Obstetrics, dilute antibiotics, large volumes of 4 solution, neonatal and pediatric populations. Syringe pumps are used to deliver very small, precise volumes of medication at slow rates, which is necessary for infants. Question 188. COPD clients are stimulated to breathe by hypoxia, low carbon dioxide, retaining hydrogen ions, high oxygen. In chronic COPD, the brain becomes insensitive to CO2 levels. Low oxygen, hypoxia, becomes the primary drive to breathe. Question 189. Which tissue receives the highest cardiac output and drug distribution? Skin, adipose tissue, skeletal muscle, myocardium. Highly perfused vital organs like the heart, myocardium, brain, and kidneys receive the highest percentage of cardiac output. Question 190. Which condition has a severe complication of respiratory failure? Bell's palsy, Guillain-Barré syndrome, trigeminal neuralgia, tetanus. Guillain-Barré causes ascending paralysis that can eventually affect the diaphragm, requiring mechanical ventilation.